The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox, right here on Reality Radio 101. To get on board right now, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
Hello. Good afternoon. It's Sunday, not Friday. It's Sunday, October the 30th, and it's a bit chilly here in Toronto and wherever you are. Winter is coming if you are in the North American sphere. If you're out in the Caribbean, it's nice and warm. I know that. A warm welcome to the Liquid Green Health Show to everyone, to all of our listeners in Toronto, across Canada, the United States, and around the world. We want to thank you for allowing us into your space today. Today's show is sponsored by Liquid Green Products, producers of eco-superior green cleaning products for your home, office, car, and pets. And of course, if you're not using these eco-superior green products, what in the world are you using? Visit us at liquidgreenproducts.com. Click on any product you have that you would like, and of course, we'll get it to you as quickly as possible. Today's show is a live broadcast, and like all previous broadcasts, it can be found on Spotify, on Facebook, YouTube. Just type in Liquid Green Health Show and like us if you're on YouTube, share, comment, subscribe. If you're going to Facebook, it's Liquid Green Products, Inc. Just, get there and like us, love us. You can also send us an email at liquidgreenhealthshow@gmail.com. During this broadcast, feel free to do so. Let us know where you're listening to us from. And we'd love to hear from you. Today's broadcast, like all our broadcasts, is for education and entertainment purposes only. It's designed to stimulate the mind and help bring us one step closer to living a healthier lifestyle. Last week, we had a wonderful guest. And last week, we were talking about understanding how hospitals work, right? We heard about the important role hospitals play in our lives and in all societies. Hospital plays a very good role. Now, many of our North American listeners were born in the Caribbean, and there are many as well, non-Caribbean listeners as well, that visits various parts of the Caribbean on a regular basis. And so today, we're taking our show outside of the confines of Canada and the United States. We are going to the Caribbean, specifically to the warm waters of the Caribbean Sea on the island of Jamaica. And there, we will hear directly from someone on the front line what it's like to be in that position and the daily challenging experiences. And because my co-host is very close to our guest geographically, much closer to him than we are. And then what I mean by that is, myself and our listeners are not where she is, not where they are out there in the Caribbean. And so I'm going to pass this introduction process to my co-host, Janet Cox. My name is Fred Cox, and my co-host is on the island of Jamaica. There you go, Janet.
And I know you're jealous because I know when I go every morning to the beach, you are...
I'm still in bed.
You know where to be seen. And when I tell you, I think I'm addicted to the beach. I'm addicted because when I go, I spend a minimum of 2.5 hours, and it's a challenge for me to leave.
Okay.
And I hope I'm going to be asking our guest, Dr. Rojae, Hazel. I'm going to be asking him about Black people and skin cancer because I'm in that sun for so many hours and I don't know how safe that is if you're melanated.
Don't worry, you're well protected.
So with us today is he's a young, talented doctor that I met in Jamaica when my mom was sick. Now, most of you know the challenges we've gone through. We've talked about it on the show. You're aware that she passed away in April. We were here in May for her funeral. And one of the reasons I really, really, really wanted to have Dr. Hazel on the show is because he is a doctor with heart. So many times we hear of doctors, they can never make a house call. I know different countries have different rules, but you seem rushed. They rush you through the process. And without even charging us a fee, honestly, Dr. Hazel, I will forever be grateful for that because my mom had bed sores and your clinic, you have a private clinic not far from here, and you were able to come in without a fee and you looked at her and you gave us advice and we felt so much better. So I want everybody out there who are listening, there are doctors out there who really are empathetic. They care about their patients. I'm sure that's most of them, but sometimes we don't always get to meet the one, right?
Yeah.
So Dr. Hazel, welcome to the Liquid Green Health Show. And I also want to thank all the listeners that each week they tune in and they send us their emails. And then they also invite other friends. And, you know, that's what keeps us going. So Dr. Hazel, could you tell us a little bit more about yourself? I know you worked at the Falmouth Hospital. I know you were trained at University of the West Indies. But what else can you tell us about yourself to start?
Yes, Janet. Yeah, thank you. Thank you for having me.
Yes.
Yeah, just for your listeners. Yes, I'm Dr. Hazel, Rojae Hazel. Was trained, as you mentioned, from University of the West Indies. Following that, I was further trained at Anatomy Hospital. This is still within Jamaica. That was a type B hospital. For your listeners who don't know, in Jamaica, we have different grades, from type C, B, all the way to E type hospitals.
Dr. Hazel, you're a little bit soft. I don't know if because I'm here.
Can you hear me now?
I can hardly hear you. I can hear you, but it's just that you sound soft.
Yeah, you sound a little bit distant.
Yeah.
Oh,
but
no.
Gary, is he okay? Gary, can you hear him?
He's okay, but we could use a little bit more volume, doctor. So if you can just talk a little louder or get a little bit closer to your mic.
No problem. How about now? How about now?
Yes, better.
Yes.
Thank
Yeah?
you.
Yes.
Yeah.
Right. So I was saying I was trained at Anatomy Hospital. And from there, I went on to Type E facility, which is Cornwall Regional. Spent a couple of years there, then move on in the clinics. And then from the clinics, then I move on to Falmouth Hospital. And from Falmouth Hospital, I move on in the private sector, and I've been there, ever since. And of course, that's how we met. Yeah.
Great. Yes. Now you talk about the hospitals. I didn't even know that. You said from A to what? A to?
Yeah, C, like ABC, right? So
ABC.
that's how they're.
Oh, okay.
Right.
In Canada, we have the banks. We have the A banks, the B banks, the C banks. I didn't realize we had that here. Okay, so the A bank would be what? The biggest, the best, the most efficient?
Right. So here, a type A facility usually carries more specialty, in terms of doctors and more investigation equipment, like CT scans, MRI, if needed and so forth.
Okay.
Right. While the rest, they won't really have those.
And would they be more on the private side, or would they be in the public side as well?
No, public side. For
Oh,
instance,
okay.
Cornwall Regional is a type E facility.
Okay.
They do CT scans, X-rays, ultrasounds, and so forth. For Falmouth is a type B. Well, going to a type B now, and they don't carry that one. So
Okay.
I say mostly it's just a difference in specialty and radiological investigations. What they can do.
Folks, this is an aside. This is something I just have to mention. When you come to Jamaica and you want to go into a public building like a hospital or a library, we were just talking about that today, you have to have your shoulders covered, correct? Your arms, doctor, you have to be covered.
Yes.
Is that the same?
No skin, no
private?
skin.
And you can't be in shorts or,
Funny story about that, though, a couple of years ago, it was like that, to be honest. But yeah, then again, they have been, because of the, where we are in the climate zone, there was some issues that came up, a few years about that, where they actually allow now, persons to wear shorts and so forth, because
really?
Sometimes it's hot,
Yes, I could not understand why that was. I figured it was one of the old colonial hangovers. Because for me, it made no sense to be so hot and you have to put on a shirt with sleeves to get into a public.
Right. It was like that, but they're loosening up. Yes.
Great. Now, we're going to talk about many things because I think there's a lot of interest out there. Sure. As Frederick said in his intro, so many people travel abroad. Now, right. What advice would you give to a typical tourist from Canada, from the US, UK? They're coming to Jamaica. We know our healthcare system is not bad. At least it's universal, right? I believe it is universal, correct? Like universal healthcare?
Oh no, man, yeah, man. It's fine. Yeah, man. We have everything here to cover all bases.
In some cases, like we were talking last week, that if you had a problem, that was clarified for me that it doesn't matter. They will accept you at the hospital. It's just that the bill later might not be one that you like, right? But in Jamaica, hospital is free. Healthcare is free for every citizen, correct?
That's correct. So yes. Even if a tourist should come to Jamaica from wherever they are, to be honest, as long as they show up in the emergency room, we go ahead and we treat. If they have their health cards, then the clerks will ask to use the health cards, but they will not turn them back.
Okay, that's so good to know. So, but would you still recommend that it's prudent to get the health insurance for traveling?
Overall, yes, and the reason for this is that again, because of our health system, because it's free here, for locals and even those who are overseas. The public hospitals, they tend to be very overcrowded. It's only, they only go by charge. So if they come, so for instance, and they're having a vacation, but they get a cut and they need stitches and they go to the ER, they may still end up spending hours there, because that may not be as urgent as someone else.
Yes.
So and even if that's even if they have the health insurance, but if they can extend that to a private facility, then they'll be seen much quicker there.
What's the cost for private? Like, what's the cost for healthcare? If, let's say, you were in a car accident and you were taken to a private hospital for a broken arm, is it going to break the bank? Or can an average accident, broken leg, broken arm?
Well, again, when I say break the bank, really depends on, the person itself. One person may have $10,000, just for a short vacation, one accident drain them, basically,
Okay.
But for pricing, let's use that example. If you're here, you're on a tour, let's say ATV bike riding and you meet in an
Okay.
accident, you have an injury, and you want to go to the hospital. If you have a broken bone, and you want to choose a facility, well, you're going to go to a private facility, say for instance, and you want, because talking about price here. Again, that depends on the hospital, and where you are located in Jamaica. Because we have a few private hospitals here, which the Jamaican-based one would be BOS on the northern side.
Close to the
And you have-
airport, yeah.
Right. Then you have Tony Tweets and Andrews. You have Montego Bay Hospital. Well, you have my facility, but we don't cater to that injury, to trauma cases.
Correct.
But the prices for admission is, to be honest, it's not expensive. Per night is like $8,000. That rounds out to be maybe, what's that?
800.
No, in US dollars.
Oh, in US probably about 500.
No, man. I said $8,000. So that's probably about $50 per night.
Oh, 1,000, right.
Right.
I'm thinking, right. Okay.
Right. But
That's correct. Yes.
but what the hospital, what they usually charge,
Mhm.
they charge a standard fee. So they charge like roughly 250,000 Jamaican. So that's about 1,000, maybe about $1,900, maybe, or roughly $2,000 US.
Wonderful.
Now,
Okay,
Dr. Rojae,
more.
Dr. Hazel, you
Yes.
kind of answered the question that I'm about
Sure.
to ask a little bit, but I'd like you to elaborate a little bit more. As you said, healthcare in Jamaica is free. It's free to all citizens, whether you're a legal resident or you're visiting as a tourist. And some of this service would also include things like prescription medicine and stuff like that, where in some cases they can get it for free. But I wonder if you could elaborate a little bit more as to why is it that there are such long queues in the public health facilities, and why is there such a difference in the quality of service for each of the various hospitals?
You mean the private?
Yeah.
Okay. Well, tackling the long queue, for most hospitals, it's different.
Mm-hmm.
For some hospitals, the long queue is just due to a lot of patients, the patient load.
Okay.
For some hospitals, it's due to shortage of doctors.
Mm-hmm.
For some, it may be not even doctors, it may be just nurses or registration clerks. So, and even then, there are some hospitals who may not have that challenge, but you still experience that waiting time, and that's due to certain administrative processes that they may have, in place.
Okay.
I can give you an example. Throughout COVID-19, I mean, we never really prepared for that,
Mm-hmm.
No one, I can tell you.
Like
Through
so many around the world.
COVID-19
Yeah.
experience there, just to get a COVID-19 test done, within the initial stage will take up to 2 to 3 hours.
Wow.
And that's purely based on the administrative processes,
Yeah.
So yeah, there are various things that can lend the time there. So yeah, those are some of the things that can cause the back.
But you know what? Don't feel badly about it, because I just heard right here in Canada,
yes,
at the Children's Hospital, they were announcing it on the radio just this week. Some wait time is 12 hours. 12 hours wait time. And this is Canada. And if you went to any other hospital other than sick kids, and you went into the walk-in emergency, I guarantee you, in 4 or 5 hours, you're going to be sitting there. And that depends on the time of the day or night that you went to that hospital. So don't feel badly with that situation in Jamaica.
Great. Now I'm going to bring it back a little. I'm going to bring it back. I was doing some research, Dr. Hazel, and it says that heart disease, stroke, cancer, diabetes, and other non-communicable diseases account for 70% of all deaths around the world. So that's according to the WHO worldwide. In Jamaica, it seems that the issues are about the same. It says in Jamaica, the deaths, 70% of all deaths, almost, I mean, not almost, exactly the same percentage, are due to one of the four major NCDs, the non-communicable diseases: cancer, lung disease, diabetes, and heart disease, right? And why, my question to you is, we all know about Jamaica or Caribbean people or people that live in the tropics and the wealth of natural medicines that there are. Take a thing like moringa. Companies abroad spend millions of dollars on these kind of products and they bring it back to the market. And here we are in the Caribbean. We're not taking advantage of some of the things we have naturally. Now, I know you're a doctor, a medical doctor, but 70% of all deaths in Jamaica could be prevented because of these NCDs. What can you tell us about that? What do you think is the main reason that we're having such a switch to these kind of diseases where it never used to be like that in the past?
Oh, okay. Well, I mean, I think I still think it's just a matter of the time, you know, the research was done, because if one really focuses on the cultural practices of Jamaicans, to be honest, I can tell you categorically, when someone here is sick, majority of them, they will stay home and they will try until the end. They will try all sorts of home remedies before they reach the doctor, you know.
So that my
By
perception
then,
is
by then it's
wrong.
too late.
Go to
It's
the
too late.
hospital. But right. But all right. So that's the issue now. So there's some conditions now where they're treating, but the condition is not being treated. You know, so sometimes they end up coming to the hospitals now and or to the clinics when it's too late, you know, or when the situation, you know, is bad and, you know, more difficult to treat. So yeah, in a case of hypertension and so forth, you know, they will sit, yes, and they will drink their garlic tea every day. They will drink the soursop leaves and every day.
Right.
And so forth.
Yeah.
They will try to cut salt and so forth. But sometimes what they don't understand that while those issues, while a general essential hypertension may be controlled like that, there are some cases, and most often more cases, that they'll think that, such as kidney disease, you know, some with
Right.
various corticosteroid illnesses, you know, those sort of things, you know, that will, regardless of what they're taking, will cause excessive increase in the blood pressure.
So would you say that it's a lack of education that is, you know, that is causing some of the problems? For example, even nutrition. Again, the Jamaican diet from old has changed. I know right here in our little town of Falmouth, there's KFC, there's Pizza Hut, there is a lot of the American influence or the North American influence is here. How big a part do you think that plays in what's happening to the population in terms of nutrition, diet, and hence leading to some of these diseases?
Right. Well, yes, I think education plays a role, to be honest, for most of them. The diet in terms of fast food, frankly, these are international companies, you know, because
Yes.
I mean the only fast food we have, I don't know what do we call it fast food really, is a juicy patty, but technically it is, yeah. But other than that, you have Burger King, KFC, Subway, and and a few more. Yes, so these are American, international companies. So yes, and a lot of Jamaicans, yeah, they love that. They love these things. So, the more we have these facilities here, the more they tend to be out of sync with their health maintenance.
Yeah.
But it's that's just one confounding,
factor.
one
Yeah.
factor.
Yeah.
I think it's the novelty of these fast foods that are coming in. You see it on TV, and now it's coming to a place near you, and the easy access. And most of these foods, they may taste good, but it's heavily processed. Whereas long ago, not just in Jamaica, but right across the Caribbean, people depended on the natural source of foods. So you get much more nutrition in the foods that you eat. And today, because everything is so easily accessible, a lot of people are not cooking. Sometimes in the Caribbean, it's much cheaper to buy the foods than to buy the groceries to cook the food.
Prepare.
Right, prepare.
But
So
the funny thing is here in Jamaica, a fast food chain like that, one may argue in terms of easy access.
Mhm.
Jamaicans, they just really love that thing because
yeah.
they will stand in line for hours.
Yeah, I've seen it.
The line is extremely long, and they wait.
Yeah.
It's crazy.
And they're there. And what is it? Is it the novelty or the taste, or
Of course, it's a novelty.
what is it?
We have, I mean, look at the North America. It's not a novelty, but people still, it's the convenience.
And talking about North America, like sometimes we pass by a Krispy Kreme, right? And we know what kind of fast food
Worst
that is.
donut in the world.
Yeah, and
In my
my
opinion.
God, the lineup is so
Yeah.
long for Krispy Kreme, and it's heart attack food.
Food. No, Dr. Hazel, something else that we want to talk to you about is this is from another article. The article was published in 2017, and it says the real problem with Jamaica's healthcare is not a lack of competent doctors, nurses, and other medical professionals. The main problem is the existing medical infrastructure. It has outgrown its efficiency to the expanding and aging population. And one of the things he mentioned was the fact that if you're going to the hospital, sometimes you have to buy your own medicine. So it's not just the fact that the infrastructure, the buildings, you mentioned that, that's why we have such a rise, I figure, in private clinics, etc. The problem to reach the people in rural areas, and the problem of getting the medication that's required. Sometimes you have to buy and bring in. I remember when my mom was in the hospital in Montego Bay, they said make sure she has her own water. So we had to bring in water. So how much of a problem does Jamaica, and Jamaica is now we're using it as the example, but I'm sure if we were to pick any country in the tropical zones or outside of the Western world, you'd probably find some of these issues. How big of an issue is this? And is there anything that can be done about this kind of thing?
That's a good question, because I mean, to be honest, that's what most hospitals, as you rightly said, not only in Jamaica, but across the entire diaspora, that's what those are some of the issues that they face. But here, when it comes to the aging population and even the hospital facilities, there seems to be not as much focus on upgrading the facilities.
Okay.
I mean, there are projects being done, and we have seen them, but when it comes to quality upgrades, things that last, putting not only infrastructure but the right and the most efficient administrative processes, then that's where Jamaica falls behind. Because I can tell you, majority or almost majority, right, of our issues that we face here, again, can stem from the processes that we have here, the culture.
Can stem from what?
the processes that we have here, you know, the administrative processes, the culture that we have in the healthcare system, you know.
That's what we talked about last week. Yes, that's
Yes.
an issue.
That's a
Right.
stumbling block.
When it comes to reaching the elderly, it is difficult to provide care for the elderly, and these are just a few of the things, because we have sadly, you know, there are cases coming in now with more trauma, you know, related. You'll see mostly, you know, young people. So when it comes to facilitating elderly care, you know, stroke and so forth, you know, it's becoming more of a challenge, you know, in finding bed space. But the government has instituted measures to help this. What they do, they define public health workers, you know, to go out in the homes and so forth, to care for some of these patients, but they have to be in a very bad state, you know.
Yeah.
So it doesn't necessarily covers everyone. So in terms of recommending, if you're an elder, you know, on the island, or a returning resident, or, you know, or someone who's elderly coming in Jamaica, I find that most persons utilize home care, to be honest, you know.
Okay.
There are a lot of, including myself, there are a lot of doctors across the island who does that, because whenever the hospital is full and you have a patient who just have a stroke on you, you need to do something. I mean, if you carry them in the emergency room, they will die right there in your hands, you know, and those are sadly sometimes, you know, those things do happen.
And yes, they do happen.
So what they do, what most persons do, you know, they have doctors on call, you know, for their homes or their workplace and so forth. So these are just some of the measures, some of the things that.
Because in rural Jamaica, for example, I know I was talking to a girlfriend, and she lives up in like Albertown, also Spring. If you're not Jamaican, you don't know these places. But again, this is typical of other places. And the transportation, even if there is a doctor or a hospital, it's so far away, and the road sometimes just make it such a challenge before you can get to see some, you know, a medical professional.
Yeah, that is it. So so that's what I'm saying. So if you're for instance, if you're 2 hours away from the hospital in the hills,
right,
and you have an emergency, sometimes more like you're 2 hours away, right? And the doctor, let's say the doctor is an hour away. Sometimes it's best to allow the doctor to come, which is shorter, you know, and then see, and then of course you can get an ambulance up there or so forth. But yeah, it's difficult living so far from the hospital when you have a medical issue. Yeah, it's very, especially in the middle of the night, then, you know, a lot of things can go wrong then, you know.
yes,
So ambulatory service is a problem.
definitely.
That's
right.
and lack of proper.
We don't have. For
Rojae.
instance, in America, you have a very well-established EMS system, emergency medical service.
Yep.
Yes.
That is exactly what we need in Jamaica.
Right.
Proper ambulance service here, you know.
But you know what? It's not just Jamaica. We're talking about Jamaica because you know, you're there, right? And we're using Jamaica as an example of what really happens across the Caribbean, right? In Guyana, where I'm from, Guyana is not in the Caribbean, but culturally we are, you know, people of the Caribbean. Geographically, we're South Americans. It's the same problem. The same, everything that you're talking about today happens there. I just want to take time to tell our listeners, if you're joining us for the first time or if you've joined us late, this is the Liquid Green Health Show. My name is Fred Cox. My host is Janet Cox, and we're speaking to our guest, Dr. Rojae Hazel in Jamaica. And we're basically pointing out some of the challenges that is faced with medical practitioners in Jamaica. And as I've said, it's not just about Jamaica, it's the Caribbean, where some of these challenges are being experienced. And you're listening to us on Reality Radio 101.
Frederick, I'm not sure if we have any emails. I'm not on that screen. This will be a good time to check.
I think we have a few here. Let me just pull it up while you're getting your next question. We got one from Glenn, and Glenn said, hello, Fred and Janet. Happy Halloween, if you recognize that.
Okay.
Janet, you still have to be careful in the sun. Even though your skin offers a lot more protection than Caucasian people, you can still get skin malignancies, right? So you must be careful, all right? Here's another one.
Before you move on, don't go away. Dr. Hazel, what's your comment on that? Should I, with the skin for, in the sun for black people?
No, it's true, man. I mean, it's generally known for high levels of radiation like that to cause or to at least inside precancerous lesions of the skin.
Yeah.
So yeah, whichever color we are, yes, we just still have to be mindful, of that.
Especially if you're out in that 2 o'clock sun, anywhere in the tropics, you need to protect yourself, right?
But people are up and down the entire time. It's so hot, you can't avoid it. But I mean, mine is special because I'm deliberately going 2.5, 3 hours in the boiling. Well, I try to go early mornings, but okay. Thanks, Glenn, for that. And thank you.
Here's another one from Bob. He says, love your show today, Janet and Fred. We have one from Ron, and Ron says, hi, Janet. Natural supplements may help our bodies to some extent, but folks should never stop seeing a licensed physician to get a professional diagnosis of illness and health issues. Right. That is so right. Here's one from Sadie, and she says, oh boy, she sent a picture of chocolate donuts, and she said it's for me. Thank you very much. Thank you. Remember, I have a sweet tooth, right? Yeah. And Carl says, hi, love your show. But this show is mostly about Jamaica. Wish you had a more generic type of topics on your show. They seem to always be Caribbean or Jamaican based. Thanks. Okay, we'll take that into consideration. It's just, it so happens that my co-host is down there, and she sought out the expertise of a doctor. And he's on the show today, but yeah, definitely we'll try to fit in. Okay.
But as you said before, where the world is so global now, and all the issues, apart from weather, everything tends to pertain to so many others, right? Yeah. But I definitely hear what he's saying.
Yeah, I hear what he's saying with that. But like I said, not because we are. You are in Jamaica, and our guest is from Jamaica, and we're talking about issues in Jamaica. This is a worldwide issue. It may be a little different or less traumatic in North America, but if you're in the Caribbean, everything that this doctor is saying pertains to you, right? Yeah. It happens.
Yeah, because as we mentioned in the beginning, 70% of deaths is caused from some of those diabetes, etc., right? Yeah. So that's everywhere we go. So back to Dr. Hazel, and my question for you is about the medical teams. There are a lot of times that you have from the diaspora, you'll have people visiting the less wealthy countries, and they tend to come with, with arsenals, their medical team, whether it's the eye doctor or the dentists, or they bring in medications, etc. How effective are those visits from those type of groups, from those NGOs? How effective are they? Because they're so temporary. Does that really give any kind of lasting help to this healthcare system? Or should we be trying to look at something more permanent in terms of aid or help or assistance from the more fortunate countries, the wealthier countries?
Oh, okay. Yeah, I've seen where some health teams will come on the island from time to time to assist in various surgeries. And yes, they're quite helpful. I'm gonna be honest. If for instance, let's say, even if they don't cover 100% of our problems here, right? If you have an issue, say for instance, with your, with your teeth or with your eye, that
Right.
a doctor here can't manage, or because of the patient load, I've not seen. I mean, if you should get an appointment with one of those teams and they're solved, I mean, in your eyes, they've done a pretty wonderful, a great job, because
Okay.
it was accomplished. So yeah, they've done marvelous work here. I mean, we have a lot of cases where, patients who have cataract,
Mhm.
glaucoma, those who needed various stents when it comes to their hearts, those who need an new implants when it comes to the broken bones and they didn't get to
Okay.
correct it beforehand. When they come, they bring the expertise. They not only assist with some of the surgeries, but they leave, various equipment, they leave the education and so forth.
Okay.
So,
Okay.
at the end
Okay.
of the day, even if we didn't know of a certain technique, they learn from us and we learn from them. So
Mhm.
yeah, it's always a pleasure to have doctors here joining us. Yeah, in Jamaica, yeah. And I'm pretty sure, as I say, it's it can be the same,
Yeah,
across the
right
Caribbean.
across the Caribbean, it
Right.
happens.
Yeah. And other parts of the world for sure, right? Now, just a few general questions. Infant mortality, that's one of the areas that they measure how well a country is doing. What's that in Jamaica? How are we doing with our young ones? I know the fastest growing population is the aging. That's most places in the world, right? But how is it for infants mortality? Is that still an issue in Jamaica, or is that not so bad?
Um, Infant mortality,
Mhm.
again, it's something that most, when it comes to pregnant patients and
Mhm.
baby, those are what most healthcare system really focuses on.
Mhm.
Um, Here, we are doing, I can't tell, we are doing well, because we almost, apart, I mean, there's a recent issue that came up, but that's from one hospital, but in a general aspect, you hardly hear, to be honest, you hardly hear of to
Okay.
be honest, babies dying, or or any other issues with them. Just, as I said, just because we with the doctors here, they really focuses on babies, a lot when they come into the facilities. So I'm telling you honestly. So even if, say for instance, you come and you have a broken leg and you see a baby down the hall, coughing and so forth, they will more inclined to attend to the
Yeah.
baby first, right?
Mm-hmm.
Yeah, man, always. And if there's a
Yeah.
pregnant mother in the waiting room all the way to the back, they'll go for them. Yeah,
Mhm.
man, and they'll bring them all the way up. Yeah, because they focus on those two,
Mhm.
very, very keenly, because again, they're fragile, and when things tend to happen to them, they go very fast.
Right.
Um,
Now, sorry, go
Dr.
ahead, Frederick.
Yeah, Dr. Rojae, I want to go to the world of technology. Things are changing.
Right.
There's something called AI, and that is playing a massive role in the health industry. I'm wondering, are doctors prepared or equipped to use this technology as it, becomes more popular in
In
Jamaica?
Jamaica, here,
Yeah, yeah.
yes, I don't. When it comes to new technology, we hear, sadly, to be honest, um, most often not, we're not trained, or
Oh,
we're not, aware of such technologies when it comes to,
okay.
for instance, even there's a technology where, you have portable ultrasounds that
Mm-hmm.
has been there for what, the better part of 5-6 years, and I just hear it in the healthcare system come up sometime last year.
Okay.
Say it's a new one breakthrough, but technically it's been there for a long time before.
Yeah. So these are some of the health challenges
Right.
that countries, again, not just Jamaica, but less developed countries, where money is a problem, and not just money, but the political will of governments of those countries are trying to bring these things in. And as a result, if it's not there, they tend to lag a little bit behind with these new developments and technologies.
As a matter of fact, talking about that, they were looking at Africa, for example, the richest continent on the globe, and yet in so many ways the poorest.
Yeah.
And what they were saying is that the underdeveloped healthcare systems, like in the countries in Africa, is that the multinational companies that are extracting so much of the resources from Africa, they really need to be held to account and put some of that money back into the healthcare systems in these communities, because these people do the work, they're in the mines, they're not treated well, they're in cotton, coal, and they're, doing with the mineral mines, and their healthcare is like minimal.
But that comes back to what I just said, Janet. It also comes back to political will of the governments of those countries. And if the governments or leadership of those countries don't have the foresight or the political, fortitude to stand up to these multinationals, they will always take advantage of you. Right? So that's basically what the solution is.
So, Dr. Rojae, for our little country here, in terms of money, what is it going to take to really improve the healthcare systems to bring it to a standard that is acceptable for the communities? Do we have any kind of secret weapon in the future that you can think of, something that, if they were to do this, then this would happen?
Well, my opinion, and I've been to most of the hospitals here. I've worked, if not as a student, as a worker there. To be honest, when it comes to money, I believe the country do have money when it comes to the healthcare, but I also believe that the main reason why there's such lack in or lacking delivery of the proper health services is just the cultural practices. I tell you, the administrative practices we have, they are powerful. Remember, those are what direct team members, what to do, how to do, when to do, and so forth. So, and it's not only in the healthcare, but in the political, system, because there have been talks about how to improve healthcare, but if such talks don't get push and force, and the protocols being made, then nothing gets done.
Right.
Those are just talks that are in the cabinet sitting there for years.
And that brings me to a pretty good question. Janet mentioned earlier in the in your introduction that you have a dream. You have a dream to build a hospital in Jamaica. I want to ask you, what made you come up with this idea, and what would it? I mean, there are over 30 or 40 hospitals in Jamaica. What's going to be so different about your hospital when it comes to fruition?
Location.
Right. Well, as I said, the main reason, to be honest, is to see if we can reach most of the persons who are, in the hills, are hours and hours away, because it will not generally be a hospital that caters to a lot of walk-in patients, to be honest.
Okay. Specialized.
Hospital. We go out in the field and we
I'm losing you again, doctor. Can hardly hear you.
Yeah.
All right. Yeah, right. I was saying that it will be a concierge type facility, where the doctors, they go out in the field, to see if they can reach those persons who generally can't be reached.
Yeah. And that's much needed. I remember a few years back, Janet and I and our kids went down on a mission to Guyana to deal to meet specifically with people in the hinterland, the native people, because they have a difficult time in accessing medicine. And so we went down with a group that had a medical team, and they were served, a lot of very, very difficult medical service that, they normally couldn't get from the local hospitals. So I can see where your service that you will be implementing would definitely be a help to meet those people in the rural areas.
And Dr. Hazel, if somebody wanted to make a donation to your hospital for the building process, is there a phone number or an email that folks can connect with you? We know, there's lots of altruistic Americans and Canadians who are our listeners, and you never know who, will feel put upon to say, this guy's doing a good job. Let me help him with a donation to the building of that hospital or become an investor or something. Is there a number or something?
Before you answer that, I just got an email from Helga, and she said, "Hi to Jonathan Fred. Love your guest today. Thank you very much for his service in taking an oath to help and cure people. May God bless him." Thank you very much for that, Helga.
Okay,
Helga.
Wonderful.
Right. Yeah. Yeah, man. So if there's anyone out there who wants to become a part of improving healthcare here in Jamaica, they can reach out to us. Our number is 1-876-502-3362.
Could you repeat that, Frederick?
Right. So that's
Yes.
1-876-502-3362. And of course, that's also a WhatsApp number. So
Okay, wonderful.
they can easily WhatsApp or call, and we can discuss and move forward.
Great, wonderful. And we cannot, again, we have less than 10 minutes. As we said, the time goes so quickly, but we cannot have a conversation on health without mentioning COVID-19 and the vaccines and how different countries, this is something for every country because of the pandemic. No one was immune, correct? So one of the problems that we had in terms of healthcare was the distribution. I mean, regardless whether you believed in the vaccine or not, let's say you did believe in it and it was going to help, because I know the opinions are varied out there. But if it was going to be the thing that was going to make a difference, so many countries, the poorer countries, there was just not the availability of these vaccines. How much of an impact was that in Jamaica? I know you can't speak for the Caribbean, but was that a problem as it was in some of the other countries, like in Africa?
Okay. Based on the time when the virus reached the Caribbean, and us getting it, it wasn't long, so there wasn't an issue there. However, the real issue for us was actually taking it.
Oh, right. Yes. Well, Jamaicans are smart.
So they have it, but that
may not take it.
Yes.
Okay. Well, thank you so much.
Yeah, this has been insightful. This has been.
We have just a few minutes left.
Yeah, this has been insightful. And as I said from the onset of our broadcast, although we're speaking specifically to a guest that is in Jamaica, and my co-host is in Jamaica, these issues that are mentioned, these challenges that are experienced in that country, is not only in that country, anywhere in the Caribbean. As a matter of fact, in the Caribbean have very, very good hospitals. We have teaching hospitals in the Caribbean, where students from North America go down to Barbados and Jamaica and those places to study medical profession. So it's not that there aren't good hospitals. It's just there are times that politics get involved, lack of funds to get to the people who really need help. And that is the reason why this show is on today. And as I said, a lot of our listeners are of Caribbean heritage. And then we have listeners that are not of Caribbean heritage, but they travel to the Caribbean. And so they want to know what is happening, what kind of health care that is down there. And that's why we brought the show on today.
Yes.
So
Frederick, I'm going to interrupt. Sorry.
Right, I was saying, along that note, Jamaica is actually in the center when it comes to producing doctors, because the school is right here.
The school is right there.
Where you have 600 to 1,000 doctors being released every year. So
and you do a great job training the nurses, and they migrate, they leave.
Right, exactly. And this is where nurses comes from as well.
Yes. I have one last question, because I just wanted to know, and this is a worldwide problem again. Pre-pandemic, a few years back, there used to be such a big issue with HIV and AIDS. Now, I hardly hear anybody talk about AIDS and HIV. Is this some issue that's going away, or because
this is one of the areas where I'll really commend the Jamaican government, because they have really stepped up. They have invested. They get the manpower, the training, and everything when it comes to dealing with HIV, HIV/AIDS, and I say it's not something you'll hear that's public, because when it comes to HIV, syphilis, these STIs really keep them out of the mainstream. However, on the ground, I can tell that they have been well managed. The containment is it's beyond belief, to be honest. It's
wonderful.
Almost no, I can't tell you, to be honest. It's almost non-existent. You will have the hospital, and you'll probably get 1 or 2 cases in let's say 5 months.
Wow, that is amazing. That is amazing.
Man, they really stepped up their game.
So good. So we end on a positive note, and I want to thank you again. I know how busy you are, so I thank you for taking the time out and to be with us this Sunday.
And we hope that the next time you'll be able to show the face.
No problem.
They can always Google him or look him up on LinkedIn.
Yeah.
Some doctor.
Yeah, this has been wonderful. Thank you.
All right, Frederick, I'll leave you to close us out.
Oh, we still have a few moments, a few minutes, as a matter of fact. I got more information than I thought I would have gotten. Finding out a lot more about the medical situation in Jamaica. It's not as traumatic as a lot of people will think. It is a well-run operation, but like every country in the Caribbean, every country, as a matter of fact, outside of North America, whether you're in Mexico or outside of Canada and the United States, and certain parts of Europe, they have their challenges, right? Even here in Canada, we have some serious issues with the medical profession here in Canada. If you can't even get a doctor now, if you're a patient looking for a doctor, good luck. Good luck. And doctors today, because of COVID, they're doing what, I don't know what to call it, telehealth. That's a new term. They don't want to see you. You can't go in unless you're wearing a mask. So it's not just in those countries, it's all over the world. There are challenges, and I don't know what's going to come out of this, but this has been, very, very informative. So who do we have next week? We got an hour. We have a minute and a half left. Who do we have? We don't know yet.
Next week, I'm going to be on a plane this time, so we're going to talk about what we do next week.
Yeah. Okay. And folks, this has been wonderful. I just want to say how grateful I am to be able to host the show, to bring information. We are information purveyors, and that's what we try to do, do the best of. So with that, I am going to end our show by saying, if you've missed our show, you can listen to us on Spotify, Facebook, or you can go on YouTube and you can find us there. And I'm going to tell you this, folks, health is very good to be in the state of well-being. It contributes significantly to prosperity, wealth, and even economic progress. And I can hear my music. As healthy individuals, we are more productive, and even, we may even live a bit longer if we take care of our health. So let's say, stay healthy, folks. That's all I can say to you. Stay healthy.
Let's stay healthy.
The Liquid Green.
Right.
This is the Liquid Green Health Show. My name is Fred Cox, and my host is Janet on the Reality Radio 101. Thank you.
Ooh, have a great
Thank you for listening to the Liquid Green Health Show with your hosts, Fred and Janet Cox, right here on Reality Radio 101.